A pharmacy technician receives a prescription that reads metoprolol succinate 50 mg QD. What should be verified before filling the prescription? A. Whether the dosage form is extended release. B. Whether it's taken with food. C. Whether it's stored in the refrigerator. D. Whether it requires reconstitution. Answer A. Metoprolol succinate is an extended-release formulation, and confusion with metoprolol tartrate could lead to underdosing or overdosing. The technician must verify the correct dosage form before dispensing. When preparing an 4-egg mixture, which step ensures aseptic technique? A. Wearing sterile gloves before donning the gown. B. Cleaning the hood with 70% isopropyl alcohol. C. Measuring ingredients in ambient air. D. Preparing the admixture outside the laminar flow hood. Answer B. The hood must be cleaned with 70% isopropyl alcohol before compounding. This removes contaminants and maintains sterility under USP less than 797 standards. A patient taking warfarin should avoid excessive intake of which nutrient? A. Vitamin D. B. Iron. C. Vitamin C. D. Vitamin K. Answer D. Vitamin K counteracts warfarin's anticoagulant effects, potentially decreasing INR and increasing clot risk. What does the acronym REMS stand for? A. Risk Evaluation and Medication Strategy. B. Risk Evaluation and Mitigation Strategy. C. Regulated Emergency Medication System. D. Restricted Evaluation Medication Schedule. Answer B. REMS ensures that medications with serious safety concerns are used safely by outlining specific requirements for prescribers and pharmacies. Which DA form must be used to order Schedule II controlled substances? A. Form 41. B. Form 106. C. Form 222. D. Form 223. Answer C. DA Form 222 is required for ordering or transferring Schedule II substances, ensuring controlled documentation and accountability. A laminar airflow hood must be cleaned from A. Back to front, top to bottom. B. Front to back, top to bottom. C. Top to bottom, back to front. D. Bottom to top, front to back. Answer C. Cleaning should move from the cleanest area, top, to the dirtiest, front, to prevent contamination of sterile surfaces. A technician notices a drug recall due to contamination. Which recall class requires immediate action due to possible serious health risks? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer A. A Class 1 recall involves situations where exposure could cause serious adverse health consequences or death. The abbreviation OU on a prescription refers to administration to A. The left ear. B. Both ears. C. The right eye. D. Both eyes. Answer D. OU stands for oculus uterque, meaning both eyes. Misreading it could cause incorrect administration. Which medication must be dispensed in its original container due to light sensitivity? A. Nitroglycerin sublingual tablets. B. Furosemide tablets. C. Omeprazole capsules. D. Prednisone tablets. Answer A. Nitroglycerin tablets degrade with light and moisture, so they must remain in their manufacturer's amber glass container. What is the maximum number of refills allowed for Schedule III-V drugs? A. 2 refills within 30 days. B. 3 refills within 90 days. C. 5 refills within 6 months. D. unlimited refills. Answer, C. DA regulations allow up to 5 refills within 6 months for Schedule 3V controlled substances. Which piece of information is not required on a prescription label for a controlled substance? A. Patient name. B. Pharmacy address. C. Physician DA number. D. Prescription refill date. Answer, D. DA regulations require the physician's DA number, but not the refill date, to appear on the prescription label. What is the role of a filter needle when withdrawing from an ampoule? A. To prevent contamination from glass particles. B. To maintain vacuum pressure. C. To measure medication volume. D. To sterilize the medication. Answer, A. Filter needles trap glass fragments that might enter the solution when breaking an ampoule. Which is a common side effect of ACE inhibitors such as lisinopril? A. Bradycardia. B. Cough. C. Hypokalemia. D. Constipation. Answer, B. ACE inhibitors often cause a dry, persistent cough due to increased bradykinin levels. A technician should identify which of the following drugs as a high-alert medication. A. Metformin. B. Insulin. C. Amoxicillin. D. Simvastatin. Answer, B. Insulin is high alert due to its narrow therapeutic window and risk of hypoglycemia. The beyond use date for a non-aqueous compounded product is A. 7 days. B. 14 days. C. 30 days. D. 6 months. Answer, D. USP less than 795 states that non-aqueous formulations have a beyond use date of up to 6 months unless otherwise specified. Which temperature range defines refrigerated storage conditions? A. 20 to 25 degrees Celsius. B. 2 to 8 degrees Celsius. C. 8 to 15 degrees Celsius. D. 0 to 5 degrees Celsius. Answer, B. Refrigerated medications must be stored between 2 degrees Celsius and 8 degrees Celsius to maintain potency and stability. Which law requires the labeling caution? Federal law prohibits dispensing without prescription. A. Durham-Humphrey Amendment. B. Kefauver-Harris Amendment. C. Food, Drug, and Cosmetic Act. D. Controlled Substances Act. Answer, A. The Durham-Humphrey Amendment distinguished prescription from OTC drugs and required this cautionary statement. Which is the correct action when a technician spills chemotherapy drugs? A. Clean with a wet towel. B. Dispose of it in the sharps container. C. Use a spill kit following hazardous waste protocol. D. Rinse with alcohol and water. Answer, C. Hazardous drugs must be cleaned using a designated spill kit and disposed of according to OSHA regulations. A patient allergic to sulfa should avoid which drug? A. Furosemide. B. Amoxicillin. C. Ciprofloxacin. D. Azithromycin. Answer, A. Furosemide is a sulfonamide derivative and may cause allergic reactions in sulfa-sensitive patients. Which of the following is a Schedule II drug? A. Diazepam. B. Hydrocodone. C. Tramadol. D. Gabapentin. Answer, B. Hydrocodone was reclassified as a Schedule II due to its high potential for abuse. A technician preparing a sterile 4-egg mixture should position all items. A. Behind the HEPA filter. B. On top of the airflow grate. C. Near the outer edge of the hood. D. At least 6 inches inside the hood. Answer, D. Working at least 6 inches inside the hood prevents contamination from room air. The Orange Book is used to check A. Drug prices, B. Therapeutic equivalents, C. Controlled substance schedules, D. Expiration dates. Answer B. The FDA Orange Book provides information on bioequivalents and approved generic substitutions. Which dosage form bypasses first-pass metabolism? A. Oral tablet, B. Extended-release tablet, C. Capsule, D. Sublingual tablet. Answer D. Sublingual routes deliver medication directly into systemic circulation, avoiding hepatic first-pass metabolism. When should a technician wear a chemotherapy gown? A. When filling prescriptions for antibiotics, B. When compounding hazardous drugs, C. During patient counseling, D. When cleaning shelving units. Answer B. PPE including gowns is mandatory when handling hazardous agents like chemotherapy drugs to prevent dermal exposure. Which agency oversees the safety of vaccines in the U.S.? A. DEA, B. OSHA, C. FDA, D. EPA. Answer C. The FDA regulates vaccine safety, quality, and approval before public distribution. A pharmacy technician is compounding in 4 solution that requires 20 milliequivalent of potassium chloride. The stock solution contains 2 milliequivalent/ml. How many milliliters should be used? A. 5 milliliters, B. 10 milliliters, C. 15 milliliters, D. 20 milliliters. Answer B. To calculate, 20 milliequivalent divided by 2 milliequivalent/ml equals 10 milliliters. Accurate dosage measurement is critical, as potassium errors can cause cardiac arrest. Which of the following medications requires prior authorization due to cost and therapeutic class? A. Lisinopril, B. Humira, C. Metformin, D. Hydrochlorothiazide. Answer B. Humira is a biologic drug and often requires prior authorization from insurance providers due to high expense and specialty handling. What is the maximum allowable number of controlled substance inventory audits per year as per DEA recommendations? A. 1 every 2 years, B. 1 every year, C. 2 per year, D. Quarterly. Answer A. DEA requires a biennial inventory, every 2 years, to maintain accurate controlled drug records. When reconstituting an antibiotic powder, which step should be done first? A. Add diluent directly to powder, B. Verify correct diluent and volume, C. Shake vigorously, D. Label the bottle. Answer B. Always verify the diluent type and volume before mixing to ensure drug stability and correct concentration. What is the main difference between sterile compounding and non-sterile compounding? A. Type of gloves used, B. Equipment calibration, C. Expiration date accuracy, D. Level of microbial control. Answer D. Sterile compounding, USP less than 797, focuses on preventing microbial contamination, unlike non-sterile, USP less than 795, which focuses on ingredient integrity. A patient is prescribed digoxin. Which symptom should prompt the technician to alert the pharmacist immediately? A. Dry mouth, B. Yellow-green vision, C. Headache, D. Constipation. Answer B. Yellow-green vision is a classic sign of digoxin toxicity and requires immediate pharmacist review. When preparing a TPN, total parenteral nutrition, which component should always be added last? A. Amino acids. B. Electrolytes. C. Dextrose. D. Lipids. Answer: D. Lipids are added last to prevent separation and ensure proper emulsion in the final TPN mixture. What is the role of the Joint Commission, TJC, in a pharmacy setting? A. Regulates controlled substances. B. Accredits healthcare organizations. C. Approves new drug entities. D. Licenses pharmacy technicians. Answer: B. The Joint Commission accredits hospitals and ensures quality and safety in medication management systems. A technician must identify that which drug is a proton pump inhibitor. A. Ranitidine. B. Famotidine. C. Omeprazole. D. Sucralfate. Answer: C. Omeprazole is a PPI that suppresses stomach acid by blocking the gastric proton pump. Which of the following schedules includes medications with accepted medical use but high potential for abuse? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer: B. Schedule 2 drugs, e.g., morphine, oxycodone, are tightly regulated due to their abuse potential. When handling hazardous medications, double gloves should be: A. Made of vinyl. B. Powdered for grip. C. Nitrile and chemotherapy rated. D. Reused between doses. Answer: C. Chemotherapy-rated nitrile gloves provide resistance to hazardous drug permeation and must be changed regularly. A medication order states, heparin 12,000 units in 250 ml D5W at 1,000 units/hour. How many ml/hour should be infused? A. 15 milliliters per hour. B. 20.8 milliliters per hour. C. 25 milliliters per hour. D. 30 milliliters per hour. Answer: B. 12,000 units divided by 250 milliliters equals 48 units/ml. 1,000 divided by 48 is equal to 20.8 ml/hr. Precision in 4-rate calculation prevents hemorrhage risk. In which area of the pharmacy should hazardous drug compounding occur? A. Laminar airflow hood. B. Biological safety cabinet. C. Refrigerator. D. Open workspace. Answer: B. Hazardous drugs must be compounded in a biological safety cabinet, Class 2, to protect the compounder and environment. Which form of insulin should never be mixed with other types? A. Regular insulin. B. NPH insulin. C. Insulin glargine. D. Insulin Lispro. Answer: C. Insulin glargine has a specific pH that prevents it from being mixed, doing so alters its release profile. What type of error occurs if a technician fills a prescription with the wrong drug strength? A. Administration error. B. Dispensing error. C. Transcription error. D. Communication error. Answer: B. Dispensing errors happen during the preparation or labeling of medications by the pharmacy staff. When using an automated dispensing cabinet, which action increases security? A. Allowing open access during shifts. B. Using biometric login. C. Storing all drugs together. D. Turning off transaction logs. Answer: B. Biometric authentication prevents unauthorized access and ensures traceability for controlled substances. A pharmacy refrigerator shows 12 degrees Celsius. What should the technician do? A. Continue storage. B. Ignore if door was briefly opened. C. Lower the thermostat and leave items inside. D. Document the temperature and move items to backup refrigeration. Answer: D. Medications must remain between 2 to 8 degrees Celsius. 12 degrees Celsius indicates deviation that could impact drug potency. A patient on lithium should avoid: A. Grapefruit juice. B. High sodium foods. C. High protein diet. D. Vitamin K. Answer: B. Sodium levels affect lithium excretion. Excessive sodium intake may reduce lithium's effectiveness or cause toxicity. The NDC number 54321-6789-00 represents what? A. Manufacturer, product, and package size. B. Distributor, formula, and dose. C. Pharmacy, patient, and quantity. D. Drug, route, and expiration. Answer: A. The first segment identifies the manufacturer, second is the product code, and third indicates package size. What is the correct method to dispose of expired controlled substances? A. Mix with litter and throw in trash. B. Return via reverse distributor with DA Form 41. C. Flush down sink. D. Burn in open air. Answer: B. Expired controlled substances must be destroyed under DA supervision using Form 41 and a reverse distributor. Which of the following must be documented during sterile compounding training? A. Technician's insurance number. B. Date of certification. C. Demonstration of hand hygiene and garbing technique. D. Total hours worked in the hood. Answer: C. USP less than 797 requires documentation that the technician can correctly perform aseptic hand washing and gowning. Which law established the requirement for child-resistant packaging? A. Controlled Substances Act. B. Poison Prevention Packaging Act. C. Drug Supply Chain Security Act. D. Prescription Drug Marketing Act. Answer: B. This act prevents accidental poisoning by requiring child-resistant containers for most prescription drugs. A prescription label must include which of the following? A. Drug's chemical structure. B. Pharmacy logo. C. Directions for use. D. NDC barcode only. Answer: C. Federal labeling requirements ensure patients know correct dosage, timing, and route of administration. What does USP less than 800 specifically address? A. Storage of refrigerated drugs. B. Handling of hazardous drugs in healthcare settings. C. Labeling of compounded products. D. Bioequivalence testing. Answer: B. USP less than 800 provides standards for safe handling, transport, and disposal of hazardous medications. Which is the most accurate way to measure 1.2 milliliters of a liquid medication? A. 10 milliliters graduated cylinder. B. 3 milliliters syringe. C. 50 milliliters beaker. D. Oral dosing cup. Answer: B. A 3 milliliter syringe allows precise measurement of small volumes, minimizing dosage error risk.